Hi everyone. In our last episode, we discussed payment posting, reconciliation, and denial management. Today, we're stepping into the final phase of the revenue cycle, accounts receivable follow-up and patient collections. This is where we ensure every dollar owed for services already provided is actually collected.
All right, so here's our game plan for today. First, we're going to really dig into the challenge of those unpaid balances, what we call aging AR. Then, we'll walk through what a systematic, methodical follow-up process looks like. From there, we'll talk about the modern, more compassionate way to handle patient collections. And finally, we'll look at the key numbers you absolutely need to track to see how well you're doing.
So, let's kick things off with the problem that every single practice faces, and that's the challenge of aging accounts receivable.
Now, at its core, accounts receivable, or AR as we all call it, is a pretty straightforward concept. It's simply the money that your practice is owed for the care you've already given. This covers everything from claims you're waiting on from insurance companies to the balances that patients are responsible for. And that right there is the critical question, isn't it? I mean, in a perfect world, every bill would be paid right away. But, we don't live in a perfect world. So what really happens when that money just sits there, outstanding?
This right here really tells the story. You have to think of time as the enemy when it comes to collections. Every day a claim goes unpaid, it gets older, it ages. And the simple, harsh reality is that the older that debt gets, the less likely you are to ever see that money. This is the heart of the aging AR problem, and it's a direct threat to your cash flow.
So how do you combat this? Well, it's not by just making random calls and hoping for the best. The answer is discipline. It's about building a systematic process, a reliable workflow that tackles this head-on.
I really like this quote because it separates the two critical parts of this. Having a system is what ensures the insurance claims get paid, but effective communication is what helps you collect from patients. It's all about having a predictable, repeatable process so that nothing ever falls through the cracks. Let's break down what that system really looks like.
So here's a bird's-eye view of that methodical process. It's really a continuous loop. It all starts with prevention, things like making sure claims are perfect before they're even submitted. From there, it's all about active management, tracking payments, jumping on denials the moment they happen, and making sure patient bills are crystal clear. But the real engine driving this whole thing is the monitoring. You've got to constantly review those aging buckets to see who owes what and for how long. That's how you spot a problem before it becomes a disaster.
And who's at the center of all this? Your AR team. You can think of them as the critical link, the liaison between your billing office, the insurance payers, your doctors, and, of course, your patients. To be successful at this, you really need strong analytical skills and an incredible attention to detail.
Okay, so once the insurance company has paid what they're going to pay, the focus naturally shifts over to the patient. And this brings us to a really important shift in the industry, moving toward a much more compassionate way of handling patient collections.
The old way of doing things was very adversarial. It was all about demanding payment, focusing on the debt. The new method, which is just so much more effective, is about offering solutions. It's patient-focused. It's about recognizing that people are way more likely to pay when they feel like you're working with them, not against them.
This whole strategy really rests on four main pillars. First, it starts with total transparency, setting clear financial expectations from the very beginning. Second, you have to be flexible. Offer payment plans and options, because everyone's financial situation is different. Third, make it easy for people to pay. Use technology like online portals and automated reminders. And finally, you wrap all of that in compassionate outreach. When you treat patients like partners, you build trust, and that's how you get paid.
Okay, so you have a great process in place, you have a compassionate approach, but how do you actually know if it's working? Well, that's where the data comes in. You have to look at the numbers that tell the true story of your practice's financial health. The first big metric is days in AR. This is pretty simple. It's the average number of days it takes for you to collect payment after a service is provided. The industry standard, what you should be aiming for, is under 40 days. If your number is higher than that, it's a warning sign that your cash flow is being squeezed. Next, you need to know exactly where your money is sitting. This chart breaks down your AR into those aging buckets we talked about. The goal is simple. You want the vast majority of your money living in that fresh 0 to 30-day bucket. If you see a big slice growing in that 90-plus day category, that's a serious red flag that needs immediate action.
Now, your net collection rate, this might be the most important measure of them all. This tells you what percentage of the money you're supposed to collect you actually collect. A financially healthy practice should be hitting a rate of over 95%. This is really your bottom line. And, to get the complete picture, you'll also want to track things like what percentage of your balances you're ultimately forced to write off as bad debt, and how good are you at collecting the patient's part of the bill, right there at the time of service. These metrics give you an even deeper look into how your revenue cycle is performing.
So, as we bring this all together, this is really the question you should be asking yourself. Is your collections process just a series of transactions, or is it an opportunity to build a foundation of trust with your patients? Because in the end, a truly healthy process does both. It collects the money you're owed, and it strengthens the relationship you have with your community. Accounts receivable follow-up and patient collections are essential to translating services into revenue. By developing systematic follow-up workflows, prioritizing aging accounts, and providing compassionate patient outreach, you prevent revenue leakage and strengthen patient relationships. In our next video, we'll explore reporting and analytics, how to track your key performance indicators, and use data to drive continuous improvement. Thanks for watching. If this was helpful, please like, subscribe, and leave your questions in the comments.